Coming up next on Get Caught in a Net.
Get caught in a net with a net. For your mind, body, and soul. Get caught in a net with a net. It's your intellectual radio show. Here to inspire you and encourage you to be your very best. Get caught in a net with a net.
You are now tuned in to Mind, Body, and Soul with Annette, where your host, Annette Harris, analyze intriguing life questions and concerns, such as, do Christians suffer from mental illness? Have you wondered why they act abnormal? Or you may ask, what is really going on in their minds? Do you need Annette? Well, keep listening for a biblical understanding of the psychology of the mind.
Hey guys, welcome to another wonderful segment of Mind, Body, and Soul with Annette. I'm your girl, your host, Annette Harris, and I appreciate you so much for joining us. I am the CEO of Get Caught in a Net Incorporated, your certified positive mental health ambassador and author of that nominated and award-winning bestseller, Surviving a Sinus Heartbeat. Listen, guys, I'm so excited to be here on this afternoon. I always say if you see my face around 12 noon Central Standard Time, on a Wednesday, it's time for you to come on in and get caught in a net. We're going to jump right in today. But before I get started, Lord, we appreciate you and thank you for all things. We thank you for what you're doing and how you're blessing and helping us and instructing us. We also appreciate you for Women's History Month and being able to talk with distinguished women about her story. And we pray that you would get the glory. In Jesus' name we pray. And the opening part of Hosea 4:6, my people are destroyed for lack of knowledge. Because thou hast rejected knowledge, I will also reject thee. And again, we're grateful to be here on today. We have to give our opening prayer and our opening scripture. That's what the actual Mind, Body, and Soul radio show is based off on. Now, listen, I tell you, when you come in on today, I'm going to appreciate it if you would not mind going ahead and clicking the share button. Go ahead, tag individuals in, throw up the heart, the love button, the thumbs up, if you would not mind for us on today. What you're doing, you're pushing this out to individuals to let them know that we are live. We're live on Facebook, Annette Get Caught in a Net, my YouTube channel, Get Caught in a Net Incorporated, also on Instagram at Get Caught in a Net. At the end of this segment, we're going to have this uploaded to Intellectual Radio's YouTube channel, which is where Mind, Body, and Soul is housed. So there are a variety of ways you can listen to us live and listen to the recorded version at the end of the segment on today. So please do that for me if you would not mind. I am excited to present to many of you individual that I have known for, oh my goodness, we're going to tell our ages here. It's been a long time. She's like a little sister to me, but she is out here doing some great things, and the Lord has blessed her. And I wanted to make sure to highlight her in this Her Story, What's Her Story series. I'm going to bring her on. I'm going to read a little bit of her bio. Dr. Parker is here with us on today. Dr. Markeeta O. Parker is a couple and family psycho and behavioral therapist and a clinician who will be serving as a postdoctoral clinical scholar fellow at the Family Institute at Northwestern University starting this September. She believes that as individuals, we are intended to be whole, mind, body, and soul. I like that because, go with the name of the show. Okay, all right. As a narrative therapist, she uses narrative therapy, a powerful psychotherapeutic approach that empowers clients to explore and reshape their life stories and reconnect with their own knowledge and strength. Now, I'm going to bring her on. She has much more on this wonderful bio of hers. She probably didn't give me everything, but it's a lot here. And I'm so excited. I'm going to bring her in from the virtual background. And I want you to meet this beautiful young woman of God. Dr. Parker, you're in the house. How are you?
Hi, I'm good, thank you. How are you?
I'm doing well. I'm doing well. I am so, I have to say this. I'm so excited to see you in this position that you're in now. You have always been one who have uh, excelled and you move in the spirit of excellence. I've always known that about you and Gail's girl. I see her watching over here on Instagram. Excuse me, Gail and Michael's girls. Because I was told Sunday by Mr. Alexander, take care of my baby on today. That's what he told me. No, my oldest said on today.
Oh, no.
How are you doing on today?
I'm doing well, thank you. I'm so happy to be here, and I thank you for the invitation. I'm doing well. Glad to be here.
Good, good, good. I'm so glad that you are here. Oh, Gail, you're having issues? I'm not sure. She says I guess her computer or something keeps knocking her off. But hopefully you're okay. I see you were on Instagram, but now you're on Facebook. Hopefully you're able to watch. All right, so I'm going to get started in here because, again, I'm just so excited about what you're doing. I love to highlight individuals, especially when they are doing a great and positive work. And we know that even for Women's History Month, we try to focus on and look at those women who have made great contributions in our society, in history, whether it is in their own family, in the community or what have you. So this was perfect to place you in this particular series, What's Her Story, because you have something to tell. You've contributed a lot. And I want to talk about, first of all, what is Women's History Month? What is that to you? Kind of talk about Women's History Month, maybe related to you, if you would not mind.
Sure, not at all. So Women's History, and by the way, happy Women's History Month to you.
Same to you.
Thank you. So Women's History Month to me is just in a nutshell, simply being able to acknowledge women like yourself and like you and me, where we are striving to do things that at one point or another, we were not able to do. We were not able to extend ourselves the way that we have been and the way that we are right now. And so it's a blessing to me and a privilege and all those great things to be able to be in a place right now in my life where I get to strive, I get to pursue, and I get to extend myself, not just in ways that I dream about doing, but also in ways that, God has intended for me to do. So I'm rooting for all the women, not just for this, not just this month, but, all the time. We're doing some great things out here. And so
Yes.
I'm proud of you.
I love it. Thank you for sharing that. And it's something, I think we had to fight for a whole month, right? It originally, I think, started off as a week and, but to be acknowledged as a woman in our contributions and what we offer, what we're able to offer, that, is encouraging, should I say. Yeah, definitely. So maybe talk to us a little bit. I know I read a little bit of your bio.
Yes.
Maybe give a little bit of personal background about yourself that you would like to share with us. And then let's try and segue into talking about your career and how that all came about.
Sure, absolutely. to those who are here, thank you for being here, first of all. My name is Markeeta Parker, Dr. Markeeta Parker. I am a couple of family therapist, as Bridget mentioned, or Annette mentioned earlier, who uses narrative theory as a tool for therapy. I'm also a social worker. I have a master's in clinical social work, a mentor. I am a professor. I'm also a wife, a mom, a grandma, a daughter, niece, sister, all those great things. And again, as I mentioned earlier, I'm just out here doing some things that I believe have been rooted, inside of me. And, I was once one of those individuals that would say, oh gosh, I'm this age and that age, and I'm doing things a little late in life. But no, I believe God has a plan for all of us and a purpose. And so, my background is formerly being a flight attendant, but I've always had a dream for doing more, diving more into my purpose, doing a deeper dive. And so I'm here and I'm grateful. Okay. So I'm looking forward to the great things that are to come. Yes.
Oh, wonderful. Okay. I hear you. Well, this is wonderful. I remember your being a flight attendant, yes. That career from years ago. And it's something. I'm going to hop right there because I saw a post where you described the similarities between being a flight attendant and a family therapist. Now, talk about one that you posted. Talk about that a little bit. Let's talk about the similarities and what that has to do, because you're a family therapist, you social worker, and how does that relate? How do they relate to each other?
So similar, and I had somebody DM me and say, well, tell me a little bit more about it, because how do you relate the two? And again, they're similar. And the reason why I say that is because as a therapist, we are taking care of people, right? We're mentally and emotionally equipped, right, to take care of people. And as a flight attendant, when you enter the fuselage, when you get onto that plane, you're dependent upon that flight attendant to take care of you, right, from point A to point B, from start to finish. And the example that I gave in my posting was, as a flight attendant, we encourage you to, or we're demonstrating to you how to put that mask on your face, right, in the event that we lose oxygen at some point in the fuselage. And so when we teach you how to put that mask on yourself first, what are you able to do after that? You're able to assist the next person. You're able to assist your child. You're able to assist your other family member. You're able to assist the next person sitting next to you. But if you don't have that oxygen, that ability to breathe, that ability to live, right, through the process, so to speak, then you're no good to yourself, right? And so as a therapist, when you come in to see me, you're taking care of yourself. We call that self-care, right? So you're taking care of yourself. And so it's my job to make sure that you get the tools and the information that you need to carry on with that. So when you come and see me from every week, that's what I do. I make sure that you have what you need to grow.
Yeah. Okay. That's interesting. And you know what? You're doing it from the angle. I mean, you have that background, you have that skill and knowledge to be able to address, issues or situations. Maybe we're dealing with mental health or what have you, because you've gone to school for it. I've seen and have heard, when they say what, bartenders, barbers, hairstylists, sometimes they say we're like your mental health therapists, because people just come in and just talk to them and just tell them all their issues. And sometimes they're giving advice or whatever. But, to be able to have that background and that schooling, that's a plus. That's a plus for you to have, to be able to help and address whatever situations people are going through. And I think that's so important. Now, my background is in psychology itself, and I love this field. I've always been intrigued with the field. Obviously, that's probably why I went into that particular area of study. But we don't realize how much on a daily basis all of that connects to our life, you know.
Absolutely.
I mean, you just explained it so wonderfully, the connection between being a flight attendant and a therapist. Um,
Yes.
Let me ask you about narrative therapy itself. Now, that's not a common therapeutic approach that I've heard of.
Mhm.
Um, you know, I'm not saying that I know all of the approaches, but talk to us about narrative therapy. Explain it to us, and why did you choose to go into that particular area?
Sure. So while you're in school, you're encouraged to choose a theory that you best uh, can identify with. And I think
Right.
that's important because when you sit with clients, you want to make sure that you're giving them all that they need to be able to navigate through the issues and the problems that they are incurring, right? And so
Right.
the theory that obviously set most dear and best to me for providing the information in that theory to my clients is narrative therapy. It's a narrative theory. And if you don't mind, I'll give a little background for those who do not understand what that theory is. So we all have a story. Everybody has a story. A narrative theory is, in a nutshell, a non-pathologizing, um, empowering and collaborative approach to help clients or people explore and reframe their stories. How many
Mhm.
times, all the time, we are born into a story that isn't ours? We're born into stories that aren't ours. They're whoever is grooming us. It's their story, and it's their grandparents' story, and it's their grandparents' it's their story. And so, how
Mhm.
many times do we sit here and not understand that we have a story? And so, um, narrative theory, again, it allows us to explore and reframe, our stories and our stories of adversity and trauma, and it allows us to identify a new story, right? Describing our lives in our own words.
Mhm.
Um, I think that, well, I'll also say, as you know, narrative therapy, it is a way of teaching the client to externalize the problem, to separate the problem from self, right? Because how many times do we hear growing up, or you're this, you're that, and you're not gonna, accomplish this, and you're not gonna make it in that thing, and all that is trauma from that person that is, being grown, towards us. And so, um, what I tend to use, or what I do with the narrative therapy approach in therapy is I encourage the client to understand that they're not the problem, they're not the issue. The issue of the problem is just that. It's the issue of the problem. We have to learn how to separate ourselves from that. And so externalizing ourselves instead of internalizing ourselves in the problem is a big difference. It's a healing mechanism.
Yeah. Yeah.
It really is.
I
Yeah.
love it. I love the concept. It's almost, the name of it is almost self-explanatory. But
Yes.
narrative, if you really think about it, it's kind of self-explanatory, but I'm glad you took time to explain it further. And I already love the therapeutic approach from what you because I think it really allows you, just like you were talking about, we internalize so much.
Yes.
And with that in mind, so many people suffer silently.
Yes.
And it could come from, however you grew up, or as you were mentioning, sometimes people telling you, oh, you're not going to be this, you're not going to be that, and how they talk to you. And sometimes you internalize that, unless you
Yes.
are able to deal with that. So, oh wow, this is good. Let me recognize some individuals that are here. I already mentioned about Gail. Thanks for coming in, and I believe that you're good now. Please make sure when you come in, you click tag, share it with individuals. I see Tamika Fuller Hunter. Thanks for coming in. We appreciate you. Dr. Proctor, thanks for coming in. That's another therapist I had on, was it last week? I appreciate you for coming in and joining us on today. We're talking with Dr. Parker on today, and we are still, of course, focusing on our Women's History Month and looking at what's her story. All right, that is the subtopic. But then I guess a subtopic would be narrative therapy, which is what Dr. Parker, what this is her area of study, and this is how she um, counsels and uses in her therapy sessions. And oh man, we need this. Now let me ask you. This is not even on my questions.
Yes.
As far as narrative therapy, what's the ratio in terms of Black people, whites, the different how is it received, narrative therapy?
I'm sorry, your volume went down just a tad bit. I wasn't able to hear the last part.
Oh, I'm sorry. Can you hear me now?
I can hear you. It's a little faint, but I can hear you.
Oh, okay. I'm not sure what's happening here. But I was asking about the ratio of receiving or receptive to being receptive to narrative therapy, as far as African Americans, white, Hispanics, Asians. What is the ratio there of receiving it?
Okay. I can speak to the racial as far as African Americans and Hispanics. But when I present, because at the start of therapy, that is an assessment, right? You're inviting the client in and you're seeing if they're, you're a good fit for them and if they're a good fit for you. And during those first two sessions, I do introduce the theory that I use, the narrative theory. And I do explain to them, what the theory entails. And what I found is that, well, first of all, I have to say this. My experience dealing with the African American culture in therapy, I first have to go through the process, or we first have to go through the process of breaking stigmatism. We have to go through that. And that's important to mention because that's what we deal with in the culture, unfortunately. And so once we get through that barrier, then I'm able to introduce what the narrative theory is. And that's the theory that I will be using. People tend to become comfortable with it because, like I mentioned earlier, we all have a story. People want to tell their story, even if they don't talk, even if they're kept silent, even if they stay silent. So many people come into therapy without a voice. And so I learned that people of color, I'll say that, we have barriers to break through before we get to understand, the things and the tools that are used to help us in therapy. And so when I introduced the narrative theory or that approach for what I use for therapy, people are ready to talk. They are ready to trust that space and open up. Yeah. Because otherwise they don't have the space to do it or the ability to do it.
Okay.
Unfortunately.
Okay. Right.
Otherwise. Yeah.
Okay. And you touched on something you dealt with. We have to get rid of that stigma because unfortunately that is something that we have dealt with. Although I'm not sure about you, but I'm kind of seeing how the tide is changing a little bit. More when you see, when you look in the news, look at our sports stars, entertainment stars, or people that are in the spotlight, and they are coming forward and basically sharing their experiences or what they're dealing with or what's hurting them or what have you. So then when normal or regular people see that, they're like, oh, I can do that too. I can share, I've been dealing with a little bit as well. Because we do see that people kind of follow, these stars, whether it's on social media or watching them on television, and they're trying to do what they're doing.
Yes.
So I think, I'm not sure. What do you think? Do you think the tide is changing in that respect, and the stigma is becoming less and less?
I do believe that. when I first started doing therapy in 2017, I honestly, if I could be transparent, did not think that I would see a lot of people of color. And so it didn't just bring joy to me, but it encouraged me to continue to research. It encouraged me to listen, more to what it is that we need in therapy, and how, is it that I could help and assist better with having the client presented to the family member, presented to the household. One thing that I encourage with clients is, and I'll say African American clients specifically, if you struggle with introducing therapy to your family member or family, uh, I encourage you to bring them in for a session or two. Bring them in so that we can, because if you're in family therapy and you're an individual in a household where there is, I'll just call them issues, where there are issues, um, the situation will get better quicker, so to speak, if I can have the entire household in. Once I am able to explain or have them sit in the process of therapy, it turns things around. It really does. And I would also like to add, as I, and you know this, being brought up in the church, right? Um, it's not really something that I grew up hearing a lot about being in therapy. In fact, it would be what they call taboo, out there, what they would call it taboo, but um, it's a plus. It's something, that we need to get to understand better. It is a benefit. It is something that I believe, adds to our wholeness. And it's all about, particularly understanding, that therapy is, I believe, a part of, you know, what we need to get to our healing, to get to our wholeness, right? And so, yeah, I do see a lot of change in the African American culture. When it comes to therapy, people are looking for help.
Yeah.
They're praying, but they're looking for help.
Yeah. Oh, I'm so glad you said that. I'm so glad you said that. And
Yeah.
it's something. And I know it could probably be. I'll use a nice word. It could be a chore trying to get this across to the church. Yeah, we grew up in church, and you're right. We really didn't hear, a lot about therapy or encouraging us to go to therapy, because anytime we heard something like that, we automatically thought, something ain't right with them, or something
Mhm,
like that.
mhm,
I don't want to
yeah,
use the word that we normally use, the C word, I want to
mhm,
be
mhm,
politically correct, but that is
yes,
what we have attached to it for so long.
yes,
And so then consequently, again, we did not get the help that we needed.
yeah,
I'll just throw this in here as well. Even talking about my book, my book was based off of, our journey of losing my brother. I state in the book that I believe that if we had been, as a family, had been
mhm,
introduced to therapy,
yeah,
that that would have gone a long way with me. I'm just talking about myself personally.
yeah,
I could have benefited. Now, I don't think that, and I believe my late mom would have been open to it, if it
mhm,
had been something that was introduced or something that was made, you know, uh, to be okay to do.
yeah,
Um, so yeah, we've had to fight through a lot of that as African Americans to get
yeah,
beyond that. But because I'm telling you, whatever trauma you go through, people of other persuasions, they will immediately get to a therapist,
oh yeah, yes,
probably as soon as it happens or something. And so I am glad, to hear even you say that you believe the tide is changing in that respect.
yes,
Um, I think I see there's the other doctor on here, Dr. Nakia. I think you joined us. Thank you so much. I appreciate you. If you guys have any comments or questions for my guest on today, again, we're talking to Dr. Parker under our Women's History Month, What's Her Story, talking about narrative therapy. And I know there's some therapists that are watching, even again, Dr. Proctor from last week. And she actually, when you mentioned about the church, she's a pastor and a therapist. So it's like, my hat is off to her as well, because I'm sure it's not easy trying to get that across. But again, we see that, so we see a little light at the end of the tunnel, right? As we can say. What are the pros and cons of narrative therapy that you want to share with us today?
Well, I would say the cons, let me start with that first,
Okay.
would be that, if you have a language barrier, you still get clients in that don't speak, they speak English, but it may be broken, that sort of thing. So narrative therapy might not be a technique that I would jump right into with a client like that. You want to get to the issue of why they're there first, and then slowly introduce type of things to them, because well, one thing at a time, I'll say that. And so as a therapist, as a narrative therapist, what I love to do, and this is why I identify with this theory so closely, is because I love to listen. I love to listen. I want to hear your story. I want to use that genogram, which is a tool that I use. And I want to go all the way back to, 3-4 generations. And let's figure out how this thing came about, right? So it may be a barrier for someone who's coming in therapy for the first time, who had been reluctant, who had dealt with that familial stigmatism. Let's take this slow with, this theory, and let's just talk about, let me hear your story, right? And so I would say those are the cons, but the pros are that this theory, as I mentioned a little bit before, it separates the individual from the problem. And that's not something I have to sit before the client and say, hey, listen, this thing is going to, separate you, and it's going to do this, that, and the other in this amount of time. No, what it does is that I get to listen to your story while I'm listening to your story. A lot of times, the individual listening to their own story, right? Because how many times, let me just say this, how many times, this is big in the African American culture. We are raised up, what goes on in the house stays in the house, right? And so what that does, it shuts us up. Mm-hmm. So when I'm listening to you, there are things coming out that you have not been able to say ever, not been able to share ever. Or if you did, you were betrayed with that, right? And so this thing, again, it aims to separate the individual from the problem. It allows the individual to externalize their issues rather than internalize them. It allows that individual to grow in ways and leaps and bounds that they never knew that they could. So those are the pros, that you're going to walk out of therapy with your consistency and you trusting the process. When I say that, I don't use it loosely, but trust the process. As far as you trusting that this will happen, you can get through some things, you can heal if you trust the process within yourself.
Okay.
Those are the pros.
Okay.
I could go on and on. I love this theory so much, but I know we don't have all day. But
you know what? I mean, but you're really saying some stuff today, because as I'm listening to you, I'm thinking about, I relate a lot of things that I hear. And so I'm relating, and honestly, I think my book was narrative therapy for me. I think it was.
That I need you to sign, but we'll go back to what you're saying.
Okay. Well, thank you. But I promise you, as you're talking, because I was able to sit down, you said something. You said you're hearing the story while you're hearing the story. I think that's how you said it. And it's like, I was writing my story. I learned so much about myself as I was writing. Yes. Honestly, yes. I really did. Because I was able to travel back. I had to relive everything, but I went back and I'm like, God, I really think you wanted me to write this book for myself. Sometimes I really think.
Yes. I sit with clients and I'm being healed. I sit with clients and I'm going through the process myself of healing. right? And so it's something because, again, we're the experts. Narrative theory or therapy views the client as the expert because, and it's funny you mentioned you write in the book, right? One of the things that I share with clients is to write. You don't have to write a whole story about a sentence about this or that. Write, because you know why? If we keep information or trauma or that thing, that has kept us bound in our
Yeah.
heads, it stays there. And then it produces a story that don't even happen.
See.
Never happened, never will happen, but it happened in your head. But if we write, we get healing.
Mm.
Our clients will say, who do I write to? What do I write to? That person's gone. That person's no longer with us. Write them anyway.
Yeah.
Write to them anyway. Let them know how you're feeling. Let them know what you didn't like. Let them know what you like. Let them know that you don't forgive. Let them know you do forgive. Because that will lead you to the things that need to happen.
Ooh-wee. I'm loving this. Honey, you and I, we can talk all day long. I promise you. But let me recognize some individuals here. Dr. Nakia did say hello, and she put in the scripture. She says, Proverbs 15:22, plans fail without advice, but with many counselors, they are confirmed. That is so true. So true. So true. There's a question for you over on Instagram, and I appreciate you joining in. Is this LAO? Thanks for coming in. The question is, what may be signs that my child needs to see someone? I'm assuming she's referring to a therapist. What may be some signs?
Some of the signs that I would say would indicate seeing a therapist, and depending on how old the child is. So I would say anywhere from teenager, the ages of that age group on up. Indications might look like not talking, not sharing, isolation. Just not wanting to engage, those types of things. And so I, speak to clients who are parents and they come in for themselves and they have that question. Again, having your child joining in with you on a therapy session, maybe not focusing on them coming necessarily being on them, but just saying, would you like to join me for a session? Including the men in your personal session, and allowing them to have that space to speak if they will, and if they don't, then they at least have that experience, of being in front of someone else and seeing that you as a parent is taking steps, to do better in areas of your lives, and also seeking, healing for yourself. So that's helpful.
Okay. All right. All right. Let us know if that answered your question over here on Instagram. We appreciate you. And thank you, Sharon and Tony, for joining in as well. Some names that I'm seeing. Now, I don't see all the names. So if you are here and I have not called your name out, go ahead and throw hi, a hello, so I can recognize you on today. And we have some minutes left. So if you have any questions or comments for my guest on today, Dr. Parker, you are more than welcome to throw them into the comment section. If we don't get to it live, I can alert her and she can look at it later. But this narrative therapy, I see you, Curtis Ethan Crosley. Thanks for coming in, cuz. I don't know if I recognized you, Dee. Thank you. I appreciate you for coming in as well. But yeah, you know what? You're igniting some stuff over here with me now with this narrative therapy. I just want you to know that. Because it seems like, how you say you're able to select which area you would go into, something that would relate to you. And I can see how this can relate to me. I know it ain't about me, but I can see how it can relate to me. So this is good stuff. I see you, Lady Hodges. Thanks for coming in. Appreciate you. She says hello. She's enjoying what she's hearing so far. Indeed, yes, that was you. Thank you so much. Hello to you. Hey, Sharon. Oh, is it Sharon Denise? Okay, thank you for coming in. Appreciate you. But yeah, this is some great stuff here. So can we back up a little bit? And I know you received your doctorate. It was it towards the end of last year,
October. Yes.
October. Okay,
Yeah.
talk to us a little bit about that process because I'm sure that was so exciting. I was so, and I'm still so happy for you,
Yeah.
and what you're doing. Talk to us about that process a little bit and going through and obtaining your doctorate because I'm sure you probably had your challenges, but you made it out. Talk
Woo,
to us about that.
thank God. Um, that process. So one thing that I know about, if I could just touch right here for a second, one thing that I know about me and who God created me to be is to persevere.
Yeah.
So I say that because I didn't start school until I was 37 years old. I started my associates at that time. And so with each degree accomplished, I did not know that I would be going into the next degree until the end of that degree. And so when I completed my master's, I pursued the PhD, and I love school. I love learning. I love sitting before the instructor and getting tutelage and all those great things. But this process, my goodness, I would say um, I'm grateful for it. I feel blessed that I had the opportunity to pursue something like this.
Mhm.
But during the process, I learned so much about not just me as a person or an individual, but I learned so much about purpose. I
Ooh,
learned so much about the fact that each and every one of us, all of us here, we're here for a reason. We are, and I don't say that because it sounds cliche, we are here on purpose. And so with this degree, I learned a lot about that. I learned a lot about not just helping others, not just serving others, serving myself, honoring myself, um, understanding that God has a greater plan. He has a greater plan. And yes, there are professionals like myself who are out here to emphasize that and to indicate that. And it's a privilege to be able to complete um, this doctoral degree or any degree, or to just be in this field, um, understanding that the hand of God is in, understanding that. So I hope I answered your question because I think I got off a little bit, but uh, pursuing this degree was a blessing. It taught me so much about just Markeeta.
yeah.
It taught so much about me. So, taught me so much about me. And let me reframe that, Dr. Markeeta. It taught me so much about who she is, and so it was a great experience. It
Yeah.
was. I wouldn't trade
Okay. I see. I hear you. I hear you. And I can only imagine. But as I stated earlier, Michael and Gail's girls, I've always seen that. You talked about the perseverance,
it. Mhm.
and um, what was instilled within you. And,
Yeah.
it has come out. And I love that. I absolutely love that. Dominique Barnes Walker says, hello, Dr. Parker. Absolutely a privilege and a blessing. All right. Thank you for joining us
Yeah.
and coming in. And I think I see Latoya Neighbors 4. She says hello. So thank you so much.
Yes.
Yes, to God be the glory. I see you on Instagram. That's right. To God be the glory. I want to ask you real quick, and I had it on here. What challenges did you face being a double minority in this particular area of study or just therapy, counseling in general?
Yeah. I'm glad you touched on that because at the start of this degree, um, there was a little bit of a challenge because, again, you're not used to seeing um, or experiencing a therapist or knowing much about what it entails to go see a therapist in the African American community, right? And so, for me, I went into this. Uh, this field. Unsure, a little bit insecure. If I could just be transparent, because for me, I knew what I was called to do. And this is something that came way before accomplishing any degrees. This is just, I feel like I was just put on this path to, what's the word, to kind of mold me into what I was, meant to, be doing here. So you're in the field and you really don't see many of us. But I feel like I was blessed. Dr. Dominique just chimed in. She was a cohort ahead of me in a cohort. There were a lot of us coming out of this degree. Something that I didn't expect to see, because when we go to the doctors, when we go to see specialists, things like that, that's not something I was used to seeing growing up. But being in the field now, of course, I see a lot of us. I see a lot of women, a lot of men who are in the field, pursuing and doing this great thing.
Yeah.
So, I would say, there were a lot of challenges. And because I'm a person who, I see the challenge, I feel the challenge, it can be discouraging. But at the same time, I'm going to pursue, because if I'm here in the first place, let's just get through it and get to it. And so I see a lot of us now that have come over, the bridge, and I say it that way because it's just the way it is. I didn't see many of us going through this process except for the few that I knew. And then when you enter into the field and do conferences and things like that, you see that we are out here doing great things. So there are challenges, but you get through them.
Beautiful. And I applaud you and all that have come before and that will come after, because I asked that question because it's so important. And I believe it will help us to even receive this therapy and counseling in our community. Because if we see people that look like us, that are the therapists, that are the counselors, that are the ones that have the schooling under their belt, and they know we can look at me easier. Okay, let me check and see because they can be able to relate. That's just my thinking. Be able to relate to us, our background, our upbringing as African Americans, as Black people, if you will. So that it helps. I love to see us, in these areas, in professions and careers, because it is encouraging to the rest of us. I think I saw something not too long ago talking about the Black male therapists, how I believe it's on the rise, in that area. So to hear you say that, and there's a lot of us, coming about that's encouraging. That's very encouraging to know and understand that is happening for us. Sheila Renee, thanks for coming in. She says hello. I think I saw Christine Pipkins. Thank you. Appreciate you. Just recognizing each and every one of you on today. Thanking you for coming in to join us in our What's Her Story series, Recognizing Women's History Month with Dr. Markeeta Parker. We're talking about narrative therapy and how it is so, it's good for us. All right. And she broke it down. So if you're just not joining us, you may have to rewind once we end to listen to it in its entirety. Let's do this. Let's talk about your support system. You kind of mentioned a little bit, we talked about yourself personally. Talk about your own personal support system and this journey that you've been on and how they have been there for you.
Yes, well, a lot of support system. So number one, of course, my husband, Lester, he super supportive. He's funny because, I mentioned earlier that I'd gone back to get my associate's degree about 13 years ago. And the plan was for me to go and get the associate's degree so that I could conclude flying as a flight attendant, because my son had just come along. And so I thought, I don't want to do, all the flying. So let me go and finish the degree And I got done with that degree, and I said, you know what, I think I should go on for the bachelor's because, I don't want to be competing with, these one. And he, you said associates. Okay, we'll go ahead and get that. But with each degree, so supportive, but shocked, because I thought you said you were going to get this. But he's been super supportive. I thank God that he afforded me the ability, to be able to pursue these places and these benefits, I'll call them, with educating myself. Because it's not just for me, it's for us. The support of my children, unmatched, just being able to come home and do what I need to do, attend the classes, study the way that I need to, and, my parents, my sisters, my family in general, friends, colleagues. I've had support that, my goodness, I can't even put into words how much I appreciate the support I've had. So I'm grateful for that.
Beautiful, beautiful. It helps. It really, really helps to have that. I don't know if I've ever shared with you when I was going for my undergrad in psychology. I didn't tell anybody what I was studying, and it wasn't because I didn't think that they would support me. I was just, I don't know. I'm different like that. But anyway, they didn't find out what my degree was in until I walked across the stage, and that's hilarious. But it does help to have that support system. They knew I was in school, so they were supporting me in that respect. But yeah, it helps to have that because it can kind of push you and motivate you to continue forward, and not having someone that's saying, what you doing that for? Why don't you stop? Whatever, so that's why I asked about your support system. And I knew they had been there for you. So I just wanted to have you share that. Why don't you give us some words of encouragement as we're ending on today? Something that maybe you didn't share today, you want to share as a form of encouragement to those maybe who are in this field of study, career, or not. Just some words of encouragement.
Sure. I'd like to say to all who are here and listening, if you are considering therapy, if you are on the fence about it due to stigmatism in the family, family members not understanding what therapy is, if you are on the fence about it because you don't know if you'll be received, we were talking about the church life before, now, and those types of things. Therapy is for someone who is ready and understanding what it has to offer. Meaning, if you are, because I believe so, so many of us have ended up in the position of not being able to express ourselves or not being able to talk about the things that have caused trauma and have caused, some things to come in our lives and separate us in whatever shape or form. If you are on the fence about therapy, well, for one, I would say pray about it. Pray about being led into how you can get your release. I mentioned earlier, we want to pray anyway. Prayer is always good. Prayer is an answer, right? It is something that we all should do. However, research therapy. Research, speak to someone and, not necessarily dedicate or commit to it. But understand that therapy, I believe, is also a way of God, way of letting us know that there is help outside of the church walls. There's professional help. There is, someone with the ability to bring you to the next level of understanding and to allow you to work through some things that you otherwise won't be able to work through. So I just encourage everyone here, I'm not telling everyone to go to therapy. I'm not saying that. I'm saying if you're entertaining the thought of going to therapy, pursue it and see how you like it step by step. Yeah.
Good. That's good advice. Good advice. Okay. You guys, those who may be on the fence have been thinking about it, or maybe this is your sign. Hopefully she, encouraged you enough for you to at least check it out. Like she mentioned, make sure you pray. Dr. Parker, where can everyone find you? if they're looking for Dr. Parker after this segment on today?
Well, I am, and I get this question all the time. I get DM'd. So anyone can find me. I can share my email address. I can do that. I will be starting, as you mentioned earlier, a fellowship at Northwestern this fall. I am currently not sitting with clients at this time, but I will be at that time. And so if you have any questions, if you have any questions about therapy, about what I've spoken about today, I can share my email address and I will be answering those. I can stay in touch. Yes.
Okay, why don't you rattle off your email to me and I'll put it in the comments section now.
Sure. It is Mrs. MRS dot mparker 05 at gmail.com.
At gmail.com.
Yes.
Okay. And I want to make sure I got this right before I flash it on the screen. Mrs. MRS dot mparker 05 at gmail.com. Correct?
That's correct. Yes.
All right. Wonderful. Okay, so we're going to put that in here. You're also on which social media? Is it just Instagram?
Just Instagram for now. Yes.
Okay. All right, guys. So she's what's your handle on Instagram?
You said, what's my handle? It's narrative therapist _ Dr. Markeeta.
Narrative therapist
_
Dr.
Markeeta.
Dr. Markeeta.
Yes.
Okay. All right, guys, I'm trying to put this in here so that you can just click on it and go to her. And I'm sure that you can be able to connect with her directly. Make sure I have that right. All right. So you can email her, Mrs. MRS mparker05 at gmail.com. Her IG handle, narrative therapist _ Dr. Markeeta. Is that right?
Yeah, that's correct. Yes.
Okay. Wonderful. Yeah, I got it. Okay. All right. So make sure you guys reach out to her if you, she said, if you have any questions, and while she's going before her, what do you call it? Is it a fellowship? What is it?
It is. It's a postdoctoral clinical scholar fellowship. Yes.
Okay. All right. I don't want to miss anything. Dominique did say yes. Congratulations to you. Wonderful. Wonderful. Okay. This is cool stuff. All right, so let me make sure anyone else that I did not recognize on today. I just appreciate each of you for joining in, your comments, your questions, for listening in on today. As again, we're recognizing Women's History Month. What's her story with Dr. Markeeta Parker? Now, there is a question on Instagram. I can make sure to forward it to you. I think you kind of answered it though. They asked, as a double minority, have you experienced any biases from peers of another ethnicity?
Maybe colleagues. I have experienced that from colleagues. Yes.
Okay.
And so I apply my own theory. I
go.
use narrative to get through those things. So yes.
Love it. Love it. Okay. I hope that answered your question over here. And thank you for those questions on Instagram, Facebook again, YouTube, for joining us on today. Again, we're going to have this uploaded to Intellectual Radio's YouTube channel, a little bit more exposure there as well. So we'll make sure that you guys see it and you're able to go back and you can listen to this recording again if you want to. My last question to you, can I add you to my list of recommended therapists?
Absolutely.
Okay.
Absolutely.
All right.
Thank you.
Okay. So we're going to make sure that we have that information, because I do have, because of the radio show and then my discussions every day, I do get individuals who are looking for therapists, and I always tell them, I have like a list. So I'm going to add Dr. Markeeta Parker in there this time. All right. So when she's ready to start taking on clients, if you guys want to reach out to her, you can. All right, Dr. Parker, thank you again. I
Thank
want
you.
to stay true to my time with you, and I just appreciate you so much. You know, I love you, girl. I love you,
Love you
and
back.
my hat is off to you. You continue making her story. All right.
Thank you so much. It's a pleasure being here. Thank you.
All right. You're welcome. So welcome. All right, guys, as she's exiting, again, I just want to thank you guys so much for joining us on today. And I hope that there has been something that has been said to encourage you, to inspire you on today. We will continue with our Women's History Month, What's Her Story series next week. Final two sessions, the final two sessions, I need you guys to join me, okay? Wednesday, the 27th of March, Dr. Shirley Hill, we will be in our monthly health and wellness segment. And then Thursday, there'll be a special show ending What's Her Story series with a panel of about 8 women. We are going to focus on their 50-plus year friendship and what her story is regarding that and how they're looking at society. So you don't want to miss that. Again, next Wednesday, Dr. Hill. Next Thursday will be my panel of over 50-plus year friendship. All right. And great group of women. So we don't want to miss that. So I'm going to play that promo for you for next week. And again, thank you for joining us, and we'll see you soon so you can get caught in the net. On the next session of Get Caught in the Net.
Get caught in a net with Annette. For your mind, body, and soul. Get caught in a net with Annette. It's your intellectual radio show. Here to inspire you and encourage you to be your very best. Get caught in a net with Annette. Get caught in a net with Annette. For your mind, body, and soul. Get caught in a net with Annette. It's your intellectual radio show. Here to inspire you and encourage you to be your very best. Get caught in a net with Annette.